Fellow designations in nursing is our episode topic. My guest is Donna Herring Griffith, co author of a 2022 Journal of Nursing Administration article regarding the same topic. Donna's career experience includes being a system chief nurse executive, and she was the 2009 president of the American Organization of Nurse Executives, now known as the American Organization for Nursing Leadership. Donna currently has a fellowship designation with three different organizations: ACHE, AONL, and the American Academy of Nursing. So let's get started.
Welcome to the BRG Nurse Executive Podcast. BRG is a global consulting firm that helps organizations in disputes and investigations, corporate finance, and performance improvement and advisory. BRG's healthcare performance improvement practice offers multidisciplinary services to healthcare organizations. We focus on implementation with innovative, independent, and data-driven solutions. In the BRG Nurse Executive Podcast, we discuss improving patient care by advancing nursing leadership. For more information about BRG, please visit thinkbrg.com. Now here's your host, Nick Shimolewski.
Donna, thank you so much for joining me today.
It's a pleasure to be here. It's so good to see you.
Likewise, our topic today is fellow designations in nursing. Now, the link to your article that you wrote with Dr. KT Waxman is in our episode description for everyone else to take a look at. What was the impetus for penning that manuscript?
KT and I were designated the co-chairs for AONL, the American Organization of Nursing Leadership, formerly known as the American Organization of Nurse Executives. When we started the work, we co-chaired a task force to determine how a fellow designation process would work and what would that mean to the organization, how it should be implemented, and what some of the criteria would be. Our project was very much focused on fellow designations of interest to nurse leaders. And the topic of fellow designation can be very broad, but our focus was the designation of interest to nurse leaders. We discovered that there's not a lot of track record or history published.
Let's get into the weeds a little bit and start with a somewhat easy level setting question. What exactly is a fellow designation, and how does it differentiate from both fellowship programs and then separately from board certifications? For example, I'm a fellow in the Academy of Emergency Nursing, but I also went through the 2009 Nurse Manager Fellowship Program with AONL. What's the difference between those two?
There is across the profession a good bit of confusion about the different terms that are used. And we attempted to sort that out and to put forth some definition around three different things in particular. And I'll go back to one is certification. A lot of people in our profession, many members of our profession, are very familiar with the term certification. As we, as a profession, moves from novice practitioners, many nurses attempt to demonstrate their expertise through certification. And as the listeners would know, across the board, there are many opportunities for nurses to become certified or board certified within their specialty of practice. And in nursing leadership, we have seen that for a long time in terms with the American Nurses Association and the Credentialing Center being able to be certified as a nurse executive or a nurse executive advanced. Around 2008, 2009, the AONE developed their own certification program. There were two different levels of certification where one could study and or go to a preparation course and take an exam and be certified. Certification tends to present to the public an area of expertise of an individual. And those can be pursued at any time that one meets criteria for their particular certification, their area of specialty. As you mentioned, there are many fellowship programs across disciplines in nursing, as well as across medicine, and many other professions will have fellowships Typically, fellowships are designated as a period of time where one would undergo a particular program of learning. Participating in a fellowship is earlier in one's career when they're attempting to build areas of expertise. Where the confusion starts to really get heavy as when someone is participating in a fellowship program, they're typically referred to as fellows, which is not the same as a fellow designation. And that's where we really tried to start peeling it apart and making sure that it was known to our profession that those differences are out there. And we really encouraged to think about what those fellowships were called and how they were named and the terminology that was used because it was really confusing to people. And I think to some degree, it's still very confusing in the profession. So the designation of fellow, where one is designated a fellow, may or may not have included certification. It may or may not have included a fellowship program, but typically it does include the establishment of a career record of accomplishment and contribution to a particular entity or a particular specialty. Fellow designation is really more something that comes across or later into one's career as they make significant contribution. And one thing that we noticed as we reviewed the literature was that those words about sustained, significant contribution were all parts of most all of those fellowship designations. To go through the process to become designated a fellow, the person has to demonstrate that they not only have the expertise, but that they have a track record of sustained and long lasting contribution. So, in essence, that really can't be something that's, with few exceptions, really early in one's career.
Now, how are fellowship designations used across healthcare disciplines and specialties?
One area we studied a good bit were the designations across clinical disciplines. And one in particular was the American College of Medical Informatics, of which KT was very familiar, and the American College of Physicians. These have designations as fellows. They're typically awarded post fellowship and post symptoms experience. So we saw in a number of specialties that when one would get to the level of being designated a fellow, that had already gone through a credentialing process or a certification process, many times a fellowship program, and were established in their specialty career. And throughout this work, we viewed nursing leadership as a specialty practice area of nursing. Digging into further, what designations were specifically of interest to nurse leaders? We see a lot of those across the board. I know from my own personal experience, having gone through 3 leadership fellow designations, there were different criteria for each. And I know we can speak about that in just a moment, but there is certainly something to be said for putting fellow designation as a career path or a career goal or a development goal for those earlier in their careers. We recommended in our paper that was published that taking the topic of fellow designation into mentoring and career coaching and developing career plans was an important piece that should be included. So if one's early in their career and they want to really make a difference and really make progression over time in their career, setting a goal of fellow designation, we felt was an important step to career planning.
So you kind of answered my next question a little bit already, which is how are fellow designations used in nursing? They can be used as setting a long-term goal on the journey to become a fellow. But beyond that, once there is the designation that occurs, how does nursing as a profession as a whole utilize those designations?
Theoretically, and I think practically as well, to see one be designated a fellow sets them apart as having made a contribution worthy of recognition. This is really important when individuals are seeking career advancement. It's important to a number of hiring organizations that one be designated appropriately. not all, but many. And in a search process where someone is seeking career advancement, holding a fellow designation is a building upon credentials that one might have achieved, such as their education, their certifications, and then the designation of fellow is a recognition of peers. That person has made significant contributions to their profession and their specialty. So it's used to set that person apart. I think the other way that it's used is peer to peer in looking at how one is recognized as a mentor or a person who may be at a place in their career where they have a lot of information to share, a lot of experience to share. It sets them apart as being able to contribute to the development of others. And for many of the designations that we reviewed in this process and preparing this paper, we looked at what are some of the long-term contribution requirements or expectations of those who have been designated as fellows. For example, to become designated as a fellow and then fade away was not part of our discussion. That once what it's not an end point, but another start point to a different responsibility and accountability in your professional journey. In the AONL designation, one of the expectations is that fellows, once designated, will continue to contribute to the organization, either at the local, regional, or national levels. And that could include participation not only in events and meetings, even post retirement, but also serving as mentors and coaches and providing advisement on the direction of not only the organization, but the profession. So there are responsibilities that go beyond the designation.
I'm smiling because you hit it right on the head. It's not an end, it's a beginning.
It is the
And
beginning.
it comes with new responsibilities,
Right.
not the finish line in any way, shape, or form.
Yeah.
What fellow designations are of interest to nursing leaders?
We highlighted in our work, we highlighted three different ones. One, the first one that many people are familiar with that has been around for a significant number of years is the American Academy of Nursing, the FAAN, Fellow of American Academy of Nursing. And that designation for many years has been well respected and very, very high level, mostly in the early years, a fellow designation to those in academia, but also of interest to nurses who have made advancements in leadership or global nursing practice. It's also open to association executives and others who meet the criteria. It's a very rigorous process in which you have to be either nominated or you can self-nominate, but required of everyone is you have to have two current fellows to sponsor. And it is a very rigorous process of outlining one's career journey and all of the contributions that have been made to the profession. And specifically in the academy designation, there is an expectation that you have a significant body of work in a particular area. Many of our listeners would know that many nurse leaders have expertise across many areas and have made contributions to many parts of the profession. Nurses who have served in executive practice, but also are academicians and who have run projects or had their own consulting businesses. So they have expertise in lots of different things. And the academy designation, the applicant has to have sustained and consistent contributions in one particular area. The others can be brought in as supportive in moving the application forward. But in particular, that service or that contribution has to be significant and deep rather than limited to one area.
It's so interesting to hear you talk about this because serving on the Academy of Emergency Nursing board right now for the last several years, I review the applications for the Academy of Emergency Nursing, and our story is very similar of Give us a story, take it narrow and keep it deep. Don't give us a laundry list of different things that you've done and a scattering because that literally is superficial. It certainly can contribute to the overall story, but it's not enduring, it's not substantial. You gotta deep dive one story or maybe two. And that's the
Mhm.
difficult thing. A lot of people have a hard it's hard to sum something up in one
Mhm.
contribution or one area of contribution. How do you pick something like that when you feel like I'm doing all these different things? I really
Mhm.
don't know what my area. How do you work with people that maybe you're sponsoring to help them identify this is the one thing you really need to focus on?
A very good point. And in particular, that's probably the hardest thing that I see nurse leaders have to do is to not tell a thousand things. Nursing's really good at telling about a thousand things, all the different thousand things that are going on with patients and telling the whole story. In that particular designation, as well as others, you have to say no. Where is the area of expertise where you spend most of your time? Where have you published? Where have you participated with either led yourself a research project or participated with an academic partner? What was your role in that? How did you go deep? How did it get implemented? How did it get measured? How is it sustained? And really drill down on that one thing and start sorting out all the activities versus the actual root of the contribution and how that is deep and how it has been sustained, not something new that we started last 6 months ago, but we don't have measures yet. But how do you know that it is significant? How do you know it will be sustained? And helping people to focus on those activities that they've done where they actually have disseminated the work either through publications or presentations or partnerships. We find in some of the organization nurse leaders who have the magnet designation have international partners and they've been able to disseminate some of their work on an international level. So I think that's probably the hardest thing that people have in shaping their readiness for fellow designation is to pinpoint and deeply explore what their particular area of expertise is.
So we've been talking about this topic a little bit around what the criteria is to become a fellow. I'd like to explore that a little bit further. As I mentioned earlier, I'm a fellow in the Academy of Emergency Nursing, and our criteria is to recognize nurses that have made an enduring and substantial contribution to the emergency nursing specialty. Those are the words that are used, and there's subcategory criteria within it, but that's
Right.
the key component that we're looking at. You have 3 different fellow designations that you were talking about earlier. Can you talk a little bit about how those criteria among those 3 different groups are similar and how they're different?
I think just having covered the American Academy of Nursing, I think I spoke to most of that in that it is a very specific telling of that special area of expertise. I'll mention another one, the American College of Healthcare Executives, which we covered in our work and in the paper, and that is the ACHE fellow designation. And that designation is very, I think, very different and it has evolved over time. Not specific to nursing, but one that many nurse leaders and nurses in executive positions have pursued as it is very much a peer designation that you see across C-suites and others in executive type roles. It's always best to go to the website of the organization that we're speaking about because of what I may say today that was accurate when we wrote the paper may not be the exact today. But in ACHE, the requirement for fellow designation were membership in the organization with 3 years of tenure and then to have a master's degree or a certain amount of work experience. And their certification exam is part of it as well. They have a certification exam for certified healthcare executive, CHE, and then you have all the other criteria met. Their continuing education requirement is very specific in that the ACHE requires that you have a certain number of ACHE designated continuing education units. So you have to build your ACHE educational profile as well as meet their requirements and take their certification exam. And then it is, and you have to have another point, is some type of community service or service to the profession, such as taking on an emerging healthcare leader and being very deliberate with their mentorship. And that designation is renewable. It has to be renewed every few years with continuing education units. You don't have to recertify, but you do have to document your community activities. Once one reaches the a retirement phase, they can become a fellow retired status. So you still have to do some of the education requirements that you can become a fellow with a retired status, which changes the dues a little bit and number of hours, and some of the other requirements. But that one, you will see a lot of the College of Healthcare Executives, the FACHE designation, with people across all areas of their career, because someone could come out of a master's program and be a member for 3 years and build enough criteria and educational units, take the exam, and be designated a fellow earlier in their career than what you might see in some of the others. The other one of particular interest is the designation for the AONL. It has components of all the other certifications. The significant and sustained contribution, I think, is the one that is probably most prevalent in the AONL designation. And it speaks to also contribution to the specialty of nursing leadership as well as to the organization. So there's an expectation that there is some participation in AONL, the organization, either working at the regional, state, or national levels on committees or making some contribution, some level of attendance at the activities of the organization. But really, that mentoring of leaders, the contribution to AONL at regional and national levels, and being an AONL member for, I think, at the time of this paper, 7 years, and having an advanced degree at the master's level or higher, with one of the degrees being in nursing. So that's a little different from some of the others that don't specify exactly what the education is. The AONL criteria does designate that. The first year AONL fellows were inducted was 2019. So it's a fairly new, comparatively speaking, a fairly new designation of interest to nurse leaders compared to the academy and to the ACHE.
Now, certainly this will also vary from one fellow designation to another. And you talked a little bit, at least, about ACHE and the need to continue to meet qualifications to sustain that status. But generally speaking, across the board, what are fellow responsibilities once they receive that designation? You mentioned earlier mentorship, but what else? I'm a fellow, now what?
For the ones that I'm most familiar with, which would be the academy and the AONL. Of course, I'm familiar with ACHE, but it's really a very different type, where you're still involved by developing yourself. When you're a fellow in the academy or AONL, the expectation is that you take on something. Whether it's mentoring, which I think is the biggest one, or service in the organization. There's a real need in the organizations for service at state and local levels. Sometimes it's hard to break into the national arena, although there are many opportunities to do that through committees and appointments on the board and such. But it can be developed by the person. It's just that it has to be there, and you want to always contribute. And it can be through publications, or like for KT and myself leading this committee, this charge we had that made the major contribution to AONL in terms of helping to set the stage for the implementation. Our task force took 2 years to develop the concept, to write the criteria, and go through the first round of designations. So that's one way to look back. But I think that picture of how the engagement is defined is up to the individual to do that.
Okay. Can you share a little bit about your personal and professional journey towards receiving each of these fellow designations?
Oh my goodness. First off, my experience, I'll speak to not a fellow designation, but certification. Early in my career, certification was very important. And I think that still is the case for many of our colleagues, especially those who are early in their career, to become the clinical expert or the expert in their area of their specialty. And I think that lays the foundation for planning for the rest of your career. For me, I aspired to the academy way before I knew a whole lot about it. I was a member of the American Nurse Association, which is part of the requirement for becoming a fellow in the American Academy of Nursing. So I learned about it then and set forth that goal in my own professional development. I was too early in my career when I first pursued it. And my first time to apply to the academy, I was not selected. And I think that's a story that should be told as well. Walking through the process and having that be a learning experience and then having mentors that help you shape the rest of that journey is really important. It's my experience with that designation. For the American College of Healthcare Executives, I was very fortunate to join an organization back in the late 90s that, as a member of the executive team, the CEO was very active in ACHE as a regent. And one of the requirements for his executive team was that everyone on the team had a goal to become the CHE certification and to pursue fellow advancement. So it was part of our incentive goals in that position I was in. So I became very informed and mentored in that direction. And it was part of my incentive. So it was a great mix of learning about that. And I've really enjoyed that interdisciplinary approach within ACHE because you are there with everyone from students in the health administration type programs all the way to CEOs and nurses, nursing techs, and everyone together, and physicians too. And then with AONL, because KT Waxman and I were the co-chairs of the designation committee, we could not apply. So we worked on the committee for 2 years. We saw it to its implementation. And then in the third round of applicants, KT and I were inducted as fellows of AONL. And I think that our contributions in the committee had a lot to do with that because not only that, but I had the opportunity as serving back in 2009 as the AONE president at the time. And I had served on a lot of the committees and been very involved in the organization. But my experience with the AONL process was I knew it pretty deep when I went through the process myself, but we had to go through the process and the review and the writing of the documents and everything just as anyone else would have. But I think that the everything about fellow designation, I can't find anything to say negative about it. It's a learning process. It's certainly a very worthy career aspiration for individuals. I think learning about what it is and what it's not and planning for it early in one's career is really, really important. I think that's part of a mentor's role if one is working with individuals who are early in their careers is to say, what you thought about fellow designation and where that fits in your future and on your timeline. And no, what is that? I've had that experience. And then to be able to tell the story about fellow designation and what one gains from that personally, the recognition is very rewarding to be recognized as an expert or a contributor in your chosen field. And that's very rewarding, just like achieving certification is very rewarding to know that you're designated as an expert in your practice. So I can't really see a downside.
Any closing thoughts as we wrap up this episode?
I just would encourage everyone to put this on their development plan. If you haven't done it yourself, to put it out there as a goal. And if you have done it, and you are serving as a mentor or coach to anyone in the field who could benefit from it, I would encourage you to ask that question. Have you thought about it?
Donna, thank you so much for joining me today and
You're
discussing
very
all
welcome.
things fellow designations in nursing.
You're very welcome. Thank you for asking me to join you.
You've been listening to the BRG Nurse Executive Podcast, which focuses on improving patient care by advancing nursing leadership. The views and opinions expressed in this podcast are those of the host and podcast guest and do not necessarily reflect the opinions, position, or policy of the guest employer, Berkeley Research Group, or their other respective employees and affiliates.